Hey guys, my name is Morgan Gott and I did my project on fall prevention. During my clinical rotation at Eastern State Hospital, I spent my hours shadowing an RN, BS, and nurse in admissions. I was familiar with how things were running on the units, but I was not familiar with how things worked in admissions. I started off my practicum rotation learning about the legal side of things and what criteria must be met for a patient to present or be admitted to the hospital. Patients either present on a citation, petition, court order, or voluntarily. When a patient presents voluntarily, they are evaluated by a QMHP, which is a qualified mental health professional, and the qualified mental health professional determines if that patient then goes and gets evaluated by the physician. If the physician decides that they want to admit the patient, then they go upstairs to be admitted. If they decide that they don't want to be admitted because they don't meet criteria, then they're A&I'd or kind of discharged. They're not going to be admitted to the hospital. If a patient presents on a court order or a petition or a citation, depending on what county they're from, they're evaluated by QMHP or a physician, or they're just automatically admitted due to their court order, and then assessed by the physician and the nurse, and then admitted to a unit. After learning about the legal side of things and what happens to get a patient admitted, I then watched how the admission process works, assessing patients, putting charts together, giving report to the physician after the nurse does the initial full physical and psychosocial assessment, and then doing the transfer handoff communication with the unit nurses before sending the patient to their designated unit. I decided to do my project on fall prevention through identification of fall risk factors and early fall prevention interventions in admissions. I created a 5-question pre-test and post-test and a fact sheet for all admissions staff who would participate to see if the fall scores were reduced with increased fall risk and prevention knowledge. My learning goals were understanding the risk factors for falls, understand how falls can be prevented, assess whether an intervention is effective. Is my educational handout beneficial to reducing the number of falls within an organization, and in this instance, admissions? Does identifying fall risk factors and implementing early fall prevention interventions in admissions reduce patient falls? My plan was to create a fact sheet for employees and identify the risk factors for falls, test their knowledge with a 5-question pre-test, give them a handout, and then test their knowledge with a post-test. Implement hospital practices to reduce falls and assess whether the fall numbers decrease across the hospital. These learning objectives were met for this project. I accomplished this goal by creating a fact sheet for all staff members in admissions, then administering a 5-question pre-test and post-test. Post-test scores on identifying falls risk and falls prevention increased after receiving the handout. Staff members in admissions understood the risk factors for falls and the importance of recognizing a falls risk in the initial nursing assessment. It helps prevent falls on the actual units. Admissions staff also recognized the importance of communicating patient falls risk when transferring the patient to their assigned unit and how falls are prevented. There were no falls in admissions during my practicum rotation. However, falls among the units remained consistent, no increase or decrease, regardless of early detection admissions. I do believe in order to see more results, my project would have to be implemented on a grander scale, so all the unit employees be administered the pre-post test and receive the educational handout. And I would also need to collect data over a longer period of time, months, not weeks. My implementations were, I had quite a few. Each patient will be assessed for falls risk at the time of admission. This helps identify falls risk factors and early fall prevention for when they are transferred to their unit. A fall risk assessment will be performed daily and with each fall. If a patient is found to be a falls risk, they will remain a falls risk the rest of their hospitalization. Once identified as a falls risk, a PRP falls focus are open. A red armband to identify falls risk is placed on the patient. They're also provided with double-sided non-slip red socks, and a red leaf is posted outside of their door. The shower in the patient's room is also turned off, and if they need to shower, we assist them in a tub room. A safe environment is provided, free of clutter, spills, good lighting, and staff understand risk factors for falls. Hospitalized patients in an acute phase of their disease have specific characteristics requiring specialized assessment to prevent falls within the context of their environment. Age, comorbidity, previous falls, gait, visual impairment, lighting, footwear, environment of the hospital, and/or medications are all risk factors for falls. And staff will remain in compliance with trainings and the most current fall prevention trainings. Each employee received this pre and post test that I gave them, and there's 5 questions. I also included it on the PowerPoint. Average pre-test scores were 88.5%, and post-test score average was 97%, so it did increase with the handout that I provided. The handout will be on the next slide. Only 7 employees participated. It was kind of hard. Admissions is pretty busy, but and I kind of saw the same people pretty frequently on the shifts that I was there. So I would need more participation to get better results. These are the documents, falls risk factors. This was the handout. This is the nursing assessment that is done on every shift. If a patient does fall on the unit, you make sure they're free of injury. MD is notified, documentation of the fall, and then there is a fall protocol initiated, a red leaf, the red socks, a red band, shower turned off. And then you have a fall scene investigation that the shift coordinator fills out, and it's about 25 questions front and back about describe the fall, fall summary, fall location, and that's how the hospital gets their data on falls. Medications, were they already a falls risk? This is the falls data for the hospital. Total falls to date as of the end of June were 177, and it just shows kind of the breakdown of where they, at Eastern State, where they happen. The majority of the falls do happen in the hallway or the bedroom. And a lot of them were due to mobility issues. So, are they have trouble walking? Do they need help with a transfer? Overall, my practicum experience was wonderful. I got to witness interprofessional teamwork and effective communication, which went hand in hand with what I was reading in the literature. Communication and interprofessional teamwork skills are a huge part of the protection from injury and complications that nurses provide for patients. Safety is drastically enhanced when the communication center uses clear, precise communication and provides an opportunity for clarification. When my preceptor and I admitted a patient, we were utilizing interprofessional teamwork by working with every member of the healthcare team. Through clear, precise communication, we relayed information to all the respected parties involved in the patient's care. When a patient is admitted to the hospital, the nurse does the initial assessment. After the nurse gathers all the information they need, they give the physician a summary of their assessment before the physician meets with the patient. This allows the physician to determine if the patient is a reliable historian or is consistent with their answers. And it also allows the physician to get any important information that they may want to follow up with the patient. In the readings, we learned about different techniques to communicate information effectively. The technique that is mostly used in admission is the SBAR, Situation Background Assessment Recommendation. We use this technique when handing off information after interviewing the patient to the physician, and then we also use the SBAR when we're giving a report to the charge nurse on the unit that the patient is going to be transferred to. In the literature, we also learned about patient safety, quality of care, and high reliability organizations, communication openness, feedback, and communication about error, frequency of events reported, handoffs and transitions, staffing, overall perception of patient safety, teamwork, staff training, work pace and pressure, organizational leadership. Those are all key components of patient safety and quality of care. Those were very prominent within the organization at Eastern State in admissions. The leaders within this organization established patient safety as a strategic priority and engaged with clinical staff to communicate and build awareness. This organization has a very effective reporting system that shares key information from one shift to another with all clinical personnel. I noticed a little bit of everything from the literature during my practicum experience. It kind of went hand in hand: interprofessional teamwork, good communication skills, patient safety. All that stuff is everything nurses use just in your general shifts. I really feel like I learned a lot with my practicum site. The best practices in fall prevention focus on identifying and addressing risk factors for falling and then implementing those interventions to reduce these risk factors. Eastern State uses all the best practice fall prevention interventions. They're being utilized, they're being updated. All the employees are current on trainings. I was very impressed with the ways that this organization does use to prevent falls. They do use a lot of close one-to-one observations also that I noted, that if someone is really a high fall risk, they will have someone that is always with them at all times to reduce falls. During my practicum experience, I got to witness interprofessional teamwork and effective communication. And overall, I learned a lot from my preceptor. She did a phenomenal job at helping me gather information on falls within the hospital and showing me the process and admissions. Our readings about interprofessional teamwork skills and communication really helped me notice how well the team works together to admit patients and get to the units with the important information, the S-bar technique. Without the effective communication from all members of the healthcare team, the patient would suffer and more errors would occur. I've really enjoyed this rotation admissions at Eastern State. I retained a lot of knowledge that will help me move forward with my nursing career. I enjoyed seeing a completely different side of the hospital, seeing as I work on the units, like the acute side. I appreciate the process that goes into admitting a patient from the legal standpoint and the assessment standpoint. I do feel like I was utilizing a lot more nursing skills like the physical assessment, psychosocial assessment, really talking with the patient. We talk to the patients on the units, but you really get to know way more about the patient in more detail when you're actually the one that's interviewing and doing the physical assessment. I really enjoyed working at patients and doing the full medical side. And then here are my references.